All right. Okay, a little bit of an intro on me. My name is Lisa Funk. I work out of a salon called Simplicity Salon. I'm in King, across from the King's Table. I've been doing massage for 18 years. I took my training in Minneapolis. My training consisted of anatomy, physiology, reflexology, aromatherapy, some healthy forms of cooking, and spa services. I no longer do the spa services. You need to be an esthetician in Wisconsin now to do those. But I am a licensed massage therapist. My training, after taking that initial training, has been based on things like reflexology, or a little bit of reflexology, some Reiki, which is an energy-based work, some cranial sacral therapy, myofascial release, and my favorites have been the deeper tissue work. I love doing trigger point therapy. Trigger point is where the muscle becomes shortened in a certain area, and when you can go in there and kind of irritate that, it expands and the muscle becomes its correct length again. So it's one of my favorite things to do. I like being able to change muscles. If you come in and your shoulders are up to your ears, I want to help you bring your shoulders back down again. So that's a passion of mine. So because of that, my work tends to be a bit deeper. It's a deeper massage. So if someone says, hey, I got a deep tissue massage, kind of that's what I aim for. And deep tissue doesn't need to mean painful, although sometimes that hurts good feeling, the wow, someone finally hit that place that's really been bothering me and it's relieving, is a good thing. But actual pain during a massage is something that you would say, hey, this hurts, please find a different way to do it. We don't need to be in pain during this. It just needs to be therapeutic, effective, as opposed to hurtful. So a couple of the benefits of massage are that you're going to increase the circulation. Anytime I give a massage, I am pushing that blood toward the heart. And because of that, nutrients are moved throughout the body, and you tend to heal faster. Any cuts or things like that, which of course I'm not going to work on any open wounds, but it helps heal quicker. New nutrients help things heal. The lymph flow increases. Our immunity of the lymph system is a big part of our immune system. So the more you get that lymph flowing, the more your body can fight off infections. It can fight off little viruses that come your way. So regular massage helps you stay healthy. It relaxes the muscles, of course. Body awareness, being aware of your body. I don't know how many times people have come in and said, you know what, I didn't know that hurt. I didn't know my arm was bothering me until you started working on it. Or I didn't know my legs were feeling so tired or sore until you started working on them. And body awareness is a big portion of prevention. If you know your body is not feeling quite the way it normally should, you can look into it a little bit quicker. It decreases spasms and cramps. It increases flexibility. If you come in and you can't bend forward, and I work on your hamstrings a bit, you're going to be able to bend forward a little bit more, or a lot more in some cases. It decreases recovery time after strenuous activities. If you went out and, mowed the lawn or shoveled and you're hurting, and sometimes because you haven't used those muscles for a while, it takes 3-4 days to stop hurting, that time can be shortened with a massage. My favorite part of massage is that release of natural painkillers. This is where finding a way to reduce pain medications comes in. When I give a massage and someone comes in a lot of pain in an area, I'll go in first to that area, kind of let them, that muscle, know I'm there. It can be a little bit painful, but then I back away. And the reason I'm backing away is because the body at that point will shoot out endorphins and oxytocin, all these really good hormones, and bring the pain level down. So when I go back in again, I can get a little bit deeper into that muscle. I can see if I can't change it, and it's not nearly as painful. Because of this, massage is great for like post-op pain. So if you've had an operation and there's some pain attached, massage is great for that. Of course, it's great for chronic pain, trying to figure out how to deal with everyday pain, bringing the pain level down or finding ways of coping. And again, if you're looking to reduce your pain medication, massage is a really good way to look into doing that. It helps with edema. So you have swelling of any sort, say breast cancer and your arms are swelling. It helps with moving that fluid through and helping with the swelling. It also helps with scar tissue. When your scars form, sometimes they form not very well. You know, your normal tissue is ideal, but scarring, if you have to be cut into or if you have an injury of some sort, sometimes kind of gets gunked up, and massage can help smooth that out. You can get in there and do some cross friction, and the scar can clean itself up. So it's great for scars. Helps with range of motion. So you come in, I can't move my neck, but like this far, and massage can definitely help bring your range of motion back to where it needs to be. Decreases migraines and headaches depending on the cause. Helps with deeper sleep. Helps with better digestion. Increases or improves mood. And all of these have been proven. Because massage is becoming more mainstream, there's a huge amount of studies that are finally being done to prove what we've all kind of known about massage. Oh, I know, I feel great afterwards, but why? What's going on, or how, and is it proven? Well, it finally is starting to be proven. Blood pressure decreases after you have a massage. Anxiety can bring your anxiety level down. Concentration can bring your concentration level up. Relaxation, of course. When you get a massage, there sometimes, and you don't always get to this point, but if you allow yourself to really breathe and relax into the massage, there's this point between wakefulness and sleep, somewhere in there, that is a very, very healthy place to be. It's kind of when you start twitching, like you're laying there and you're like, oh, you didn't even, your leg starts moving or whatever, but that's a very healing place to be. And when you discover that with massage, you find that you can find other ways in your everyday life to kind of get into that deeper, relaxed state. So having that massage and then maybe bringing that oil back with you that was used during the massage so you can smell that to kind of bring your anxiety level down if you're feeling anxious, or just to sit and relax with a nice warm rice pack on your back. Warm water is very helpful, a nice hot shower. Things that will kind of remind you of that place again so you can get into that almost meditative state where it's just very relaxing, very healing. So for those of you who've never had a massage before, I thought I'd tell you, if you ever do try to experience it, what to expect. When you go in and say, hey, I want to get a massage, or you're gifted a massage, someone gives you a massage. You could go in and any massage therapist should have you fill out a health form. If they don't, I would be a little cautious. There are some things that are contraindicated where you should not be getting a massage. Now, in most cases today, you can probably get some form of massage. So you come in and say, you know what, this is just hot and swollen. The massage therapist probably isn't going to touch that area, but she can work other areas. She could do, or he could do reflexology and work on your feet, work on your scalp. So there's most likely some massage that can occur even if there's a contraindication in one portion of your body. However, if you come in with a high fever, massage is contraindicated. You shouldn't be getting a massage. You want to wait till the fever's gone. If you're actively ill, I would wait till you're feeling better.
Why is that?
For actively ill?
Yeah, well, other than
like a cold
germs
or something like that.
Yeah.
In some cases, actually, a massage is okay. However, if you're coming in and you're like at the throes of the flu, it just is, one, uncomfortable. You don't really want to pass the germs.
True.
And sometimes with the lymph flowing, you can actually feel worse. What will happen sometimes is if you're coming down with something and you get a massage, it will push it through you quicker. And you'll leave and be sicker than you've ever been. Now, mind you, it'll probably last a shorter period of time than it normally would. but it isn't maybe say the pleasantest thing.
How often
You really,
can you get a massage?
you could get a massage daily if you wanted to, but a therapeutic massage, I would say, I have a couple of people who come twice a week. So, you know, my deep tissue massages, I wouldn't say daily. I'd say, like I said, twice a week. I try not to do too much more than that for people who are
What is your recommendation?
preventive. A lot of people do about 4 weeks, every 4 weeks.
Like once a month, basically?
Yes. Some people do every 2 weeks. It really depends on how it fits in with what works for them. Some people do once a year. You know, it's what they're doing it for.
Works for you,
Mhm.
basically.
Athletes like to do a little bit more often, sometimes once a week.
Is it not indicated, like if somebody has muscular dystrophy or something?
You can do it with muscular dystrophy, sure. Yeah. Diabetes,
Arthritis?
arthritis, it's great for arthritis because again, we're moving fluid.
It's
So,
synovial fluid.
mhm.
I teach exercise classes.
Yeah.
here, so
Awesome, yeah.
that's-
So,
yeah, I
it's
mean,
great
the
for
exercise
arthritis.
and the massage would go hand in hand, I
Mhm.
would think.
Mm-hmm. Definitely. So after you've taken that health history, and the one reason, or of all the reasons that I really do enjoy massage, and if someone says, well, so why do you do it? I think it's a beautiful blend of science and art, because you need to know your body and what's going on with it, but you also get to work in an environment where there's beautiful music playing, and it smells good, and the table's warm. And so you go into a place where you can just leave your stresses at the door and, you know, enjoy a massage.
Oh, some people wanna know, do I get all undressed? And they get
Oh,
really
yeah,
panicky,
definitely. Hmm.
But you're all covered.
You are all covered. And I usually say you can get undressed to your level of comfort, meaning if you want to keep your bra and underwear on, that's just fine. And then I also do offer chair massage, which means you stay completely clothed and sit on a chair. And that's comfortable for some people, definitely. And so I try to make it as comfortable as possible.
What are your rates?
My rates are about $1 a minute. I have an employee. She's $50 an hour and $25 for the half hour. And I think I'm actually under or right in the middle. I think some places do more like 66 an hour. I haven't looked around lately.
How long does she work?
I haven't looked around. So for the chair massage, you can do any increment of minutes. Some people just come in and get 15 minutes. Some people go all the way up to, not on the chair, but all the way up to 90 minutes, an hour and a half of massage on the table.
Oh, they'd be sleeping.
Yeah.
Insurance covers it?
Some insurance covers it. Not mine. I don't
Mine don't.
do insurance. You'd have to look. I think there's more places doing the preventive massage thing. I know some once a month, some
About
insurances
30 years
cover
from
that.
now, they might change.
Yes, hopefully
That
shorter
wouldn't
than
do us
that.
any good.
They're pretty
Well, we
stubborn.
couldn't live forever. Me too. Not gonna make
There you
my
go.
husband's life that easy.
Only the good die young.
I guess I'm around for another 100 years.
Yeah.
Oh, I love
I'll
that.
join you. I wanna know somebody in the group.
Okay, so as far as well, let's see. As far as how massage fits in with, say, chiropractic, physical therapy, your regular doctor, when to think of massage as, hey, is this going to be better or more helpful? Anytime you have a muscle-related challenge, massage should be thought about at least. If you go to your regular doctor, a lot of times you're going to find that they're going to offer you pain medication. And more and more people, at least from what I'm hearing, would prefer not to go there. And mind you, I don't think there's anything wrong with that choice. Sometimes people will come in a great deal of pain to me, and honestly, the thing I think would be best for them would be a little bit of pain medication. When you get to the point where you're in so much pain that it's hard to lie on a massage table or walk, or any movement is painful, to kind of calm the whole system down, is okay, I think, to get to a point where your body can do a little bit of its own healing. Because when pain is so high, stress or your stress hormones are really keyed up, and it's hard to almost get it under control. And if you can get it under control, and then we can work gently into the muscle, it's helpful. And it's something you have to be kind of careful of, because when you're on pain medication and you come in and get a massage, you may not be feeling the full effects of this. And if I say, hey, how is my pressure? You may not be able to tell me honestly. Well, you'll honestly tell me, but you may not know. You know, you may hurt the
Because
next
it's
day.
covered.
Right,
That's
right.
what it feels.
So you have to be careful with that. So if you ever do go get a massage and you're on pain medication, please let the therapist know, and they can adjust accordingly. So you don't wake up the next day thinking, oh, wow, you know, that's a whole different kind of hurt, but it still hurts, you know, because they went in maybe a little bit deeper than your muscles could handle. Now, chiropractors are going to deal with your bones. They're dealing with the central nervous system. If you, say, go out, slip on some ice and fall, a chiropractor, and you haven't broken anything, a chiropractor is great. They will set you back into place. The sooner you get in there, the better. The sooner your muscles don't form into that shortened situation, the better. Go in and get an adjustment. Have them do their magic. But if you're chronically, you know, using this arm or in front of a computer and your muscles are starting to shorten like that and they're starting to be painful, a massage therapist is a great option. Physical therapists, you know, they're covered by insurance, so they're, you know, one of the go-to things for doctors. Hey, check out the physical therapist. They do something now that I'm really excited about, and it's called dry needling. Has anyone experienced dry needling yet?
Doesn't sound good.
Well, there are needles involved. But what they'll do is take a needle and actually put it in the trigger point. And that's what I like to do with my hands, get into that trigger point. But the needle will go right directly in there, irritate the area. Sometimes hurts like crazy, but you get quite a bit of relief with that. It is like acupuncture.
Yeah.
Yep.
Yeah, it's one of those.
Kind of creeps me out.
It's not for everyone, but it is pretty effective when it's done correctly. And the physical therapist will teach you those exercises, which are great for prevention. You know, they're going to say, hey, if you change that motion to this motion or whatever, if you stretch out this, or if you do your exercise this way, they can help you prevent it in the future from happening. But there's nothing like, you know, half an hour, 15 minutes, 60 minutes of hands-on therapy. It's different than a physical therapist who's doing all these assessments. It's different than the chiropractor. It's nurturing. There's been many studies done on the effects of massage in infants, especially like preemies, where they need this touch. We as humans need it. And I think we kind of forget that as we get older. Maybe it's not as important, but it is. It really, truly is. And some people get touched so infrequently. I mean, if they get a hug a week from a friend, that may be it. So I have a lot of clients who come in once a week to get a massage, and I am very certain I am the only one that's touching them during that week. And they're getting touched. It's important. It's important for your health. It's important that the nurturing feel of that. It really is. So, and they're healthier because of it. They have less colds in the winter. But, you know, it is a very healthy form of therapy. So, it can help with, and doctors, you know, again, you know, do you want to try doing it with less medication? And I have had a couple of doctors who say, hey, you know what, you need to go get a massage. A massage should be a part of your healing. It's definitely muscular. And doctors are starting to realize that a massage done correctly can be really helpful.
I think a lot of the problem too, especially with probably people of my generation, is even though we know it's beneficial and it's good for us, it's still kind of, some of us think it's a frivolous way to spend money.
Right.
Even though it's not, you know.
I agree, and I totally get that. I do. I find with people who've never experienced it before, and they come in and experience it, a lot of them will say, you know what, I get it. And they start. So I have a lot of people who be like, it was a gift, and they'll reschedule because they feel that much different afterwards, that it is something. So I encourage you, anytime you see someone doing free massages with a chair out somewhere, or it's a donation sort of situation, try it. See what you think. It's
And ask your chiropractor if
Right.
they recommend it. Mine did,
Yeah.
and that's how I went.
Mhm.
Because she was recommending,
Yeah, to get a
So-
massage.
if
Mhm.
only the doctors would do that, but I was.
Yeah.
But I do have some people who will talk to their doctors. Doctors are quite open to it now and say, you know what, I need massage and my flex spend is going to cover massage. Can you prescribe this? And I've never had anyone come back and say they didn't prescribe it. They just say, yes, how often do you want your massage? And let's be helpful in that way, because they know that 80 to 90% of illness or time off work is stress related. Somehow has stress in it. It's a component of it. So doctors are way more apt to say, you know what, if this is helping you, if this makes you feel better and it's not involving drugs, because they are becoming like, hey, you know what, we don't want to give as much pain medication, then let's do it. So I've had no one come back and say, my doctor wouldn't do it. It just,
Yeah.
any doctors who's experienced massage too is more apt to say, yeah, definitely, we'll put it on there. So in that respect, I do have clients who come in and I give them a receipt. They submit it to their flex spend and it's covered, and they get a reimbursement. So that's as much as I get into the insurance thing, because insurance it's messy.
It is.
It really is. And I like my life kind of clean. I don't want to.
And it's sad.
It is.
And you pay such a big price and all the things that you think could help you, then they don't want to pay it.
Right.
Yeah.
And you're paying such a big premium.
Mm-hmm. Yeah. So
I do. I pay a big premium and, well, they cover my husband for all his cancer stuff. But
Mhm. And cancer and massage, that's cancer can be helpful in every stage of massage, or every stage of cancer. The treatment, any portion of what's going on, it can be helpful. After chemo, also like diabetes care, it's great for that, because again, you're with the nerves and the circulation, getting those nutrients moving, helping with the uptake of the insulin and things like that.
I've had a massage.
It takes so much.
I've had a massage and it didn't work on me.
It didn't work on you?
No, so I have a TENS machine that I have to wear.
Okay, okay. It maybe, did you just have a really relaxing massage? Was it gentle?
Yep.
Sometimes, as nice as the therapist wants to be, it's not a super helpful massage. If someone comes in pain, the massage I give is it's different. If someone comes in and says, you know what, I just want to relax, it's going to be maybe a gentler massage. So I'm sorry it didn't help. I think given the right therapist, it probably would be effective. As I do have someone who used to use a TENS and doesn't need to anymore because of the massage.
That would be wonderful.
But it's not a cure-all. I'm not going to say, hey, I can cure you. It's not like that. But massage can be very effective for muscular challenges.
Hurt my whole back and down my left leg for the sciatic.
Sciatic, yeah.
And it didn't help.
No, yeah. I'm assuming they probably just didn't address the area that was really needing it. And sometimes too, when it comes to pains like that, we also have to look at, how's our posture? What's actually causing it? There's a reason why it happened. And so massage is just a part of a picture of, hey, I can help you with this pain. But then do discover why.
Well,
Why
my tailbone or my spine is off.
that'll
And
contribute. Yeah.
That's what, but then I've still got pain.
Yeah.
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 So it doesn't
So
go
you
back.
could need both, your chiropractor and.
That would, yes, and it really just kind of getting to the bottom of it. Someone comes in with low back pain, there are so many things that could possibly be causing this low back pain. Could be something going on the foot and you're starting to walk. It could be the stomach muscles. You know, whenever we sit, those muscles shorten, and if we're sitting, driving, those muscles can shorten and really pull in the low back. The sacrum, the sciatic, all the muscles surrounding the low back area, the ligaments. There are so many things that can contribute to low back pain. So I would say, you know, if you're open to it, try another massage and find someone who specializes in pain and helping you get back to.
She supposedly,
Did she?
she was supposed to be, she was recommended to me,
Okay.
and, she's supposed to be good at it, but.
It didn't help. Did it help at all? Was there any relief at all?
No.
No relief at all. I'm sorry. It's no fun to get a massage and not.
About 2 years ago that I had
Okay.
it.
Okay.
I've had this TENS machine since,
Since?
2002.
Is the TENS helpful? I mean, are you able to
yeah.
get it under control with it?
Oh,
Good.
yeah,
Good.
between that and medication.
Okay. Okay. All right. So, any other questions?
See the price again.
Price is about, for me, $1 a minute.
Are you open 7 days a week?
No.
I mean, not Sundays, I'm sorry.
No Sundays, but I am there every other day of the week, yes.
Okay.
And it's by appointment,
Saturdays?
even Saturday mornings. hmm Yep.
And you need your services after I get back from
No.
Florida. We're
There you
driving.
go.
It's gonna be
Oh.
4 days in the car going down,
Yeah.
4 days in the car coming home.
That's
the
a
worst
good
for
long
me
drive.
is the sitting too much.
Yes.
Sitting too much is the
Yeah.
worst thing for me to take drives or
Mhm.
car trips.
What about when she
No.
done that thing across
I
the
can
front?
stand up and work
Was
and
supposed to
be
drive
in the
up.
kitchen, but that's sitting too much in the
Yeah,
car.
I mean,
It's
even
too
with
much.
doing this stuff,
Yeah,
if I
sitting
sit
too
more
is
than
right.
an hour, I'm in deep trouble.
Sitting
Yeah.
down,
At home, I
she's
would
done a
get
lot
up at
for you.
every intermission,
Mhm.
almost. Just
Smart.
to stand up and do something.
I wanna say something.
Sure.
I've used Lisa as a massage
Yeah,
therapist,
for a little something.
just for a relaxing massage.
Go do
Sometimes I
something.
have
You
some
know what,
issues
I
with
always
my
tidy
back.
up or something,
and,
wherever you need to go, 'cause sitting
When I
is the
get
worst
done with
for
her,
my
sometimes I
sake.
only do a half hour with her, but it really helps me. And she's really good at what she does. There's
Thanks,
a
Chris.
testimonial there.
Thank
so.
you.
That's always nice to hear.
Well, I know you must be okay because didn't you do Dan Orr?
Oh,
That's my daughter's father-in-law.
Yeah.
Yeah.
I love
He always-
Dan.
Yeah, he
hmm
always wanted to go.
Yes,
Did you
fantastic
bring any
man.
brochures?
I brought some, I don't have brochures. I'm busy, so I don't, I don't advertise much. No, it's great. But I did bring some articles. I have my number here. I do an employee, so right now she's the one I send people to if I can't get to them. It's about 3 weeks out. I'm booked. But she's a little bit more available, and she's been doing massage about 2 years. I can hand these. Or you hand these around. Here, I'm gonna
Gift
grab one for.
certificates,
I
so that's
do. I
nice.
do.
No,
That would make a nice gift.
not everybody does.
And
If you knew
Alicia
they
is
were
also.
a bit interested.
Sharon doesn't
Yeah,
either.
you do want to make sure they want to
Yeah,
have
if they're
massage.
interested.
But I usually I allow the gift certificates to be transferable. So if you give it and they say no, then you have yourself a nice gift. You can use it.
I have her right
What?
here. It's Prismatic.
Don't you think Charlie would
Catherine, let me look at
with
this
all
a
the
minute, please.
Okay.
Would massage help that?
I would think so. Yes. It's worth a try. Yeah. And usually I'm the type that if someone comes in for something specific and we haven't made a difference in 3 sessions, say even if it's like 15 minutes and we're working on something very specific, if we haven't made a difference, then I usually say, you are more than welcome to continue seeing me, but maybe something else would be helpful. So sometimes, I think that I can be helpful and I get in there and I realize it's not something that I can do. And I try to be for those people who come in regularly, I try to be very aware of skin changes, things like that. So, if there's something that has changed through the weeks, like skin cancer sort of things, or if there's, something that's off, I bring that to their attention so they're aware of that too. It's another benefit of getting regular massage. Because who else is, I hold ticks, because sometimes you just don't see your back, way back there. Yeah. Any other questions? Oh, thank you guys so much. there anything else you wanted me to cover or talk about? Okay.
Are you the employee?
No, Alicia's not here today.
Yeah, no, I received the size,